Well, welcome, Teresita Batayola. Thank you so much for joining us. We appreciate it.
Thank you for having me.
Yeah. So, okay. How did you decide that it was time now to step aside from the role that you've had for so long there?
Oh my God, the way you said so long, that tells me that it's a good thing.
It is a good thing. It is a good
Because
thing.
if you are saying it that way, then other people are probably saying it in there too long. But let's face it, um, times change, and there are certain rhythms, not just to people, but to organizations, to communities, to needs. And I feel very proud of our staff and the work that we've done. But I also feel that it is a good time now for the next generation of leadership to take over and to think of community in a different way because our communities have changed. It's a lot more diverse. When I first started, we were primarily serving Asian languages. Today, we're serving 70 languages. While
70. Oh my gosh.
70, yeah. And while Asian languages are still the dominant languages, we're serving not just Spanish, but Eastern European and East African languages. And so we are reflecting our community. And this community or sets of communities will continue to evolve and will continue to diversify because we have a region that's fairly accepting of different peoples and different cultures, different religions, and different families, different individuals. So it's a good time for that next generation of leadership to come in to begin to look at ICHS, its services, how we fit with the community, and take it into that next level.
Yeah. 18 years. That's a long time to be
Yeah,
at the, but
you
let's
keep
step.
rubbing me.
Uh, no, no, it's a good thing because that meant that you have been there and you have been committed to it. You've been committed to the community and committed to, you know, the Chinatown International District, which, as you have said, it it used to be primarily Asian, but that also tells you about Seattle and
Yeah,
the
yeah.
refugees that have come here to live. But let's step back. 18 years ago, how was it then?
Well, 18 years ago, we had two sites, one in the Chinatown International District and the other one on Holly Park. And as I said, it was very, very Asian at that time. But it was also a time when healthcare and the healthcare environment was already changing. Our state has been very good in terms of making sure that low income people, that people who qualify for Medicaid had care, but it was still not good enough. Uh, at one point in the distant future, our state actually had universal health care when Mike Lowry was around and Jim McDermott was in the state senate, and he was chair of Ways and Means. But that only lasted 1 year, and then there was a sea change. The party in charge changed, and universal health care went poofed.
Yeah.
But out of the vestiges of universal health care, the state actually passed what they called basic health. And so it was directed not just at the most low income people, but the people who were falling between the cracks, wherein, with subsidized health care, they could afford to get health care. So they had to pay a little something, but still they could qualify. And I mentioned that history because that was very key for ICHS to have basic health care. We've always had a lot of immigrants and refugees in our patient population. As a matter of fact, we were founded because we needed to provide care to Filipino men and Chinese men who were here without family, had gotten old and frail. They had had hard lives in terms of labor. And then they were isolated and they were in the single room occupancy hotels in Chinatown and Pioneer Square. So we already had that immigrant history. And what this clinic did was when basic health became available, we started signing them up for coverage. So if they could pay a little something, so in other words, they were not the poorest of the poor. They were working people, but low wage jobs. And once this clinic started doing that, then this clinic got a little bit more variety, if you will, or diversity in our funding sources. So uh, before we were reliant on grants, and grants go up and down in terms of availability and how much and what is the grant topic of the day, the year, right? And it would change from year to year in terms of what need grantors identify. But with people signed up, we were able to start getting reimbursements. So what happened then is that this clinic started to grow a little bit, and it moved from a storefront location on Main Street to where we are today on 8th and Dearborn with a bigger facility. And it was able to open a second site in Holly Park. When I came on board, and this was already 2004, 2005, the clinic had grown organically, but we needed to set systems in place. But at the same time, Seattle was already becoming too expensive, and people were forced out of the city because they couldn't afford to live in the city anymore. So we were seeing our patient populations move to the south end a little bit, on parts of the east side. I know there are people who think east side doesn't have any low income people there, but certainly the Crossroads area was one of those places, and a little bit in the north end. So around 2007, ICHS, our board and I started looking at what is happening to our patient base. Are we going to continue to make people come into Seattle to get services, whether or not they worked in Seattle? Or are we going to say we're the preferred clinic for our populations, for our communities, so we need to make ourselves available? And because of that effort, that's when we started to dream about growing, to dream about locating elsewhere. And we decided that we needed to locate in areas where there are no other community health centers at that time.
Mhm.
And so that's why Shoreline became a choice and Bellevue became a choice. Even though South King County was a natural choice for us, at that time, other community health clinics were already there, specifically CMAR and Health Point. So we said, let's go somewhere where either no one's there or the service is so small that really we are needed. And so over time, we added a couple more school based health centers. We added a mobile dental clinic, which is very unusual in an urban setting. It's normal in a rural area because there are lots of distances. So you see mobile clinics, mobile medical, or mobile dental. And in our case, we had found out through our needs assessment that dental was really a big need,
Yeah.
especially among our school kids. So,
Right. And it's so important to your health. Let's face it.
absolutely. And so we ended up serving 12 schools in Seattle, Shoreline, and Bellevue. And during vacation and holiday times and teacher professional days times, we would have the mobile dental clinic serve outside with community settings, partnering with other nonprofits. And then we added a suite of senior services uh, from one of our community partners, the Seattle Chinatown International District Preservation and Development Authority, which is a mouthful to say.
Yeah, that is.
Um, they asked us to take on a congregate meal program, assisted living, and adult day health. Because they wanted to focus on their mission of community development and affordable housing development. And so we did that and added a new program, which is a Medicaid Medicare program called Program of All Inclusive Care for the Elderly. And this program targets seniors who are qualified, seniors or disabled people who are qualified for nursing home care, but really would like to stay either in their own homes or in a community setting, and with a complete wraparound set of services that range from medical, dental, PT, OT, socialization services, and transportation for appointments. They can stay in a community setting or in their homes. So we've been doing that for the last 3 years. Today, ICHS has 11 sites. So we have become a more, from pre-birth to all the way to the end of life range of services for the communities that we serve.
Wow. That just goes to show you about the change in the population, the need and the needs of the
Yes.
communities. Yeah.
Yeah. Yeah.
Yeah.
Yeah.
Let's talk a little bit about you
Oh
first.
no.
So you were born in the Philippines?
Oh yes. Yeah.
Okay. And
Your show should be Pinay y Chino y Chicano.
there you go. It has a rhythm to it, doesn't it?
Yeah.
Okay, we'll keep that in mind.
Okay. A future iteration.
But when did you come to the US?
Back in 1969, that was when our family immigrated. Um, in mid 60s, 1965, United States did an immigration reform that actually focused on more of the professional class, but also had an emphasis on having families be together. Um, and in our case, we were very lucky because my dad's oldest sister was able to petition for him to come.
Mm.
And it took 3 4 years. And for us, it was perpetuation. I can't talk. It was timely because at that time, Philippines was already destabilizing under Ferdinand Marcos. It was before martial law, but he was in the last years of his second term. And the Constitution of the Philippines prohibited him from running again. So he was doing a lot of power building, power
Yeah.
grabbing. The economy of the Philippines was in a tailspin. And I swear, every election, it seemed like my mom would force us kids to go into the bathroom because it had tiles. There was a school that was 4 or 5 blocks away from us, and there was always some shooting going on during elections. And there were these military vehicles with, soldiers obviously with guns. So it was a very destabilized situation. And coming to Seattle, coming to the United States was a big dream. My dad had lost his job because the company he worked for was bankrupt. He had an aeronautical engineering degree, and Boeing used to put ads, in the newspapers looking for engineers. It was in a big boom, prior to when we came. And then we came, and please don't blame the economy tanking on us. But
Is that
Boeing lost the SSD contract. The Concorde was the one that became the big deal. And Seattle being a one company town, Seattle plunged into a very deep and prolonged recession. And so here we are, a new immigrant family landing here in July. And I remember Neil Armstrong stepping on the moon, and with no prospects. So
wow.
yeah, we thought my dad would have a job, and we had to struggle. He ended up working at the shipyards picking up scrap metal so he could have a job and be able to feed his family. And my mom took a clerical position at, it used to be called United, it's now United Way, but before it was United Good Neighbors. And she used to complain. She used to come home and complain. She goes, they pay me a salary, but then they take big part of my salary as a donation. It's not a donation.
So you understood from an early age what it was like to live the life that many of the people you now help get health care.
Absolutely. And one of the things I say to our team is that, we need to have the best services. We need to have the best possible facilities because our patients go through a lot. Our patients have unimaginable challenges and hardships. And when they come here, they get the best welcome, they get the best service. But I will also say that many of our staff have had similar experiences, either they themselves or their family members or close friends. And so a lot of them really identify with the mission and have the deep conviction that, yes, this is the right thing to do and we must do this. And those are really the people that we want joining ICHS
Right.
because we want that empathy, that identification, so that we are always on our best behavior, if you will, on our best self.
How did you end up getting involved with the organization?
Well, the the funny thing is that when we were an immigrant, I my parents kind of forced me to get involved with, the early ICHS. So it was called the ID clinic at that time because we had the one and only clinic. And if you're familiar with Bob Santos
Oh
or
yes,
popularly known as Uncle
he
Bob,
was my uncle.
oh yeah, he was not my uncle, but I totally loved him. It was
Yeah.
strange to me that I would call this guy uncle when I'm like, he doesn't even look like me, because he was
Yeah.
so, and he had those gray eyes,
Yeah.
and anyway, so because of his amazing advocacy and radicalism, and he was really a big fighter for international district for Chinatown International District. And those days before the current stadium, they were trying to build a kingdom. And in Chinatown had already been decimated by I-5. And here there was going to be this sports facility that was going to further decimate. So when you combine the concern about the elders in the single room occupancy hotels and the dismay, if not outrage, the community felt about our elderly men, being very ill and some dying alone. And then here's a sports stadium that's going to be an incursion in the community and further destroy the community. The activism and the street marches and demonstrations focused on King County because King County was the one building the facility. And so Bob was able to push the King County government to give some mitigation dollars that helped start our clinic. So at the same time, there was a Filipino nun, and nuns are a running theme in Filipino families because a lot of Filipinos are Catholics. My parents, even though they were recent immigrants, were always active in their church back home. And as hard as our struggle was, my parents, not only attended mass, but they would figure out a way to give regardless. So they became friends with Sister Heidi, and Sister Heidi happened to be a nurse practitioner way back then when nurse practitioners were not common at the time. And so she was going to apply for a demonstration project on nursing in the Filipino community among in Filipino elders. And this was a federal grant that she was going after. And she needed volunteers to interview some of these men. So my parents forced me to do that. And
They volunteered you.
it was more than that. I will say that, I was a sullen teen. I mean, hey, I had my friends back in the Philippines. All of a sudden I'm being uprooted. I'm here, don't know anybody. I'm cold all the time. Um, so it was really a struggle of will, and I bamped and did the interviews. they were not the most comfortable because I wanted to do the interview and get the hell out of there. But the men were trying to interview me. They were lonely for families. And so they would ask me about my family. They would ask me about me. And I kept thinking, I want to get done and be out of here. Um, so it was an early exposure to the clinic, early exposure to the activists who were very engaged in making improvements to the community. But also for me as a young person who was miserable and felt like nothing is going right in my world, it was a way to see that there are other people who were in worse condition than I was. That I needed to have perspective, that I needed to be able to kind of think above myself. Uh, so it was a good thing. But I also have to say that getting exposed, not just Bob, but the other activists in the community, was an even bigger eye opener for me because in the 70s there was a lot of civil rights activities going on in Seattle. I remember when students closed down the freeway, with the demonstration for equal rights, and there were just so many things happening that even though a lot of it was confusing for me as a new immigrant, not really understanding the civil rights struggle in this country, it was still a very, very good on the ground, real time learning and opening of me as a person.
Wow. And then, as ICHS started, how did you then get involved?
Well, that was that initial involvement because that
Right.
demonstration project got funded, and so it was part of starting to get, in this case specifically, the elderly Filipino men to start coming in for care. But after that particular time in my life, got busy with college and with trying to get a good job, and so for a while I was not really as engaged with the community, much less ICHS. um, but over time, I did a lot of different types of volunteer work in the community and served on different work groups and task forces, a couple of boards, and even did a lot of, early volunteer work with elective officials because Ruth Wu had entered my life, and Ruth Wu became, I would say, my most powerful mentor in terms of really helping shape who I am today.
Yeah. She had a lot of impact on people, um, in their activism, and then
Yeah,
helping open the door and encouraging those to run for political office that
yeah.
were of color. Yeah.
I can proudly say she failed with me on that end. I told her I felt comfortable, fundraising for other causes. I felt comfortable helping people get elected, but I didn't feel comfortable calling people and asking for money for myself. So,
Right.
uh,
Let's talk about COVID and how it
yes.
impacted the organization, because it presented tremendous challenges, not only for the services that you provided, but from a financial standpoint as well.
Yeah. Yeah. Well, one of the things that is not as known about COVID is that ICHS was the very first health center in the entire country that had a positive COVID case. And that's because of our Bellevue clinic, which is not far from Life Care Center, which for several weeks was epicenter for the United States. And it was pretty early on when that happened, February 2020. And at that time, there were confusing guidelines that were available. And I have to say, really, kudos to the team at Bellevue who, our lead doctor figured out right away that she had a potential COVID case on her hand. And it was a worker from Life Care Center. And so at that time, to get tested, because testing was really not available very early then, she had to ask permission from public health to get the patient tested, and eventually she got it. But she was also very convinced that we had potentially an earlier patient back in December 2019 who was also COVID, but because the criteria at that time was travel from Wuhan, this patient had traveled from Beijing, so that that person was denied a test. So potentially COVID was in our area much earlier than we thought. Um, but from that time on, we knew that ICHS had to mobilize and get ready. Um, if if indeed it was basically tied to travel from Wuhan or even China, we knew that we have staff and patients who travel back and forth. And remember, February is Lunar New Year. So there was a lot of active travel. So we had to get prepared real fast. Uh, we had a stock of, PPE, personal protective equipment, and we were starting to burn through those things real fast. And I will say that the community was very good in helping support us. The community was, organized, gave us some donations early on, and then pretty soon some of the merchants who had masks were donating masks to us, because at that time the supply chain was not ready, did not have enough to fulfill the demand, that all of a sudden the pandemic, just exploded in terms of numbers, right?
Right.
uh, yeah. And so for us, the work evolved from, you know taking care on a clinic by clinic basis, and Bellevue continued to be very active in terms of getting those early positive cases, uh, but also realizing that we had to work with our community. Here in the International District, there was one building of affordable housing for seniors, that's operated by a firm some in California, that one of the workers at a nonprofit saw a sign on the paper that said COVID case, and we didn't know what that meant. They alerted us. So we started working with the other nonprofits here in Chinatown International District to find out, because this is a whole building and potentially we could have 100 elderly with COVID cases. And remember, at that time, people thought only the elderly was going to get COVID, right? Because
Mhm.
they were the first populations that got it. And because we did that work pretty early, uh, a couple of the nonprofits turned out to have case workers who had clients in that building. And then we partnered with others to start meal deliveries and deliveries. We worked with public health to try and figure out what can we do for testing. With that building, we were lucky because the elderly isolated themselves real fast. They were very afraid when people saw the sign, even though it was in English, and there were a lot of non-English speakers in that building. Somehow, they were able to spread the word, to isolate. So then it was a matter of making sure they had food, they had supplies, as they were isolating. The early days were very, very tough, not just for our communities, but for the small businesses in the Chinatown International District, but all over the area, how they could survive. And certainly for us, the challenge was how can we continue to provide service and be available? So we ended up with zero capability for telehealth in January to having telehealth set up by March, to be able to at least start reaching out to people, being available for people. And we got some drive through testing available here in the Chinatown International District and over at Shoreline. And we became very strong advocates with King County Public Health, with the state health department, and with the federal government in terms of making sure that test supplies were available to us, and eventually that vaccines were available to us. Early on, when testing became available, the emphasis was on mass testing sites. Well, our populations did not really go to mass testing sites. Language was a problem. Uh, but you layer on what was going on with the previous president, where immigrants and refugees were attacked. There were raids going on and people deportations going on. Lots of very harmful press in terms of derogative statements about immigrants and refugees. So there were people who were really not going to go to any kind of mass testing facility. So we had to figure out a way to be available to our populations and be effective. And over time, we eventually ended up going to different places, especially with the vaccinations, doing pop ups in mosques, in Buddhist temples, in all kinds of denominations of churches, in community settings. We even partnered with a couple of organizations serving homeless populations. So we ended up being very, very agile in terms of how we provided services. We flipped the idea of they come to us going to them,
Yeah.
and just really live that ethic, and at the same time just really being strong advocates. um, and I do think that our advocacy helped us. We ended up, along with other community health centers, getting prioritized by the state and King County Public Health. But when the feds started to provide direct supply of tests and then vaccines to community health centers, we were usually in the forefront. The first 25 among health centers. And I do think that part of our mission is not just providing the services, not just showing up, but standing up, speaking out, and getting the resources to our different communities.
And combating the hate that was out there. I mean, Asians were being targeted,
Absolutely.
communities of color were being targeted.
Yes,
And
absolutely. I mean, it is shameful some of the signs that went up in Chinatown International District that caused the whole neighborhood to board up. Uh, there were pro-Nazi segments that were coming into the community and putting up signs, and volunteers would take down the signs and clean up because we didn't want that in our community. And it was just fueled nationally, and unfortunately, it still continues to today in
yeah.
terms of what that opened up.
As we're loosening up here on COVID, and as we talk, the state has set some dates here now about not having to wear a mask at various
Yeah.
times. But what are you telling your community?
Well, first of all, what we're telling our staff is we can't ease up. Variants are still there. So we're still doing the PPE. Um, I think the messaging to the community is a little bit harder just because it is so confusing. To mask, not to mask, to vaccinate, not to vaccinate, to boost, not to boost. It is so confusing. We are still continuing to do pop-up vaccinations, and our team, at one point, people were lining up. We had to turn them away. Now our team has converted their approach to educating people, talking to people about it. The overall message is that now is not the time to relax yet. Not at this time, because we do know the variants are still around.
So, so much of this, I don't think anybody knows really what all you've been through in the past, well, 2 years in dealing with COVID, uh, trying to make sure that the community is going to be protected. Uh,
Yes.
that, but yet you adapted, which just seems to be what people have to do.
Yeah, we had to adapt, but I will admit that it's hard. It still continues to be very hard. Our staff are burnt out. ICHS is not isolated from what other employers are going through, in terms of we have a lot of vacancies. Uh, because people are not only burnt out. Um, right now, like you said, it seems to have eased up, but. Um, Schools have been opened and closed. Schools are remote. There's a case in school. All of a sudden, parents have to adjust their time, and the same thing happens. With having to take care of your elders, right? You have to constantly adjust your time. So it's not easy. I do think that we have a core of very committed employees. Um, our work is not the kind of thing you could just say, oh, I'll work from home today, even though we provide telehealth. There's a digital divide with our patient population in terms of do they have the right device? Because to be able to effectively do telehealth, you have to have a smartphone.
Right.
Do they have the right plan? Because they're not going to want to burn their precious minutes on, a telehealth visit. But we're also finding out that really people prefer to be seen, to come in, be seen. And with COVID, once patients started coming back, what our providers are finding out, our doctors, our dentists, our behavioral health specialists, is that people's conditions have deteriorated a lot. Whether it's their mental health, their body health, their oral health, it has deteriorated quite a bit. It's not just an issue of not having been seen for a couple of years, it's also the layers of stress that deconstruct our bodies. Uh, so, telehealth is not necessarily a solution for everything.
Right. It's going to be a lot of recovery that
Yes.
we'll have to go through. Let's talk about the President's Advisory Commission on Asian Americans and Native Hawaiians and Pacific Islanders. Congratulations being named to that. Uh,
Thank you.
what does that mean to you?
When sorry, I have to kind of chuckle a little bit because when President Biden first got elected and started his office, his ratings were so high that when I was asked to put my name in the hopper, I thought, oh, great, we can really do some big, exciting things, right? Um, there was a lot of talk about Medicare for all or strengthening the Affordable Care Act, which got weakened under the previous president. Um, maybe even something about immigration because there was such a dismay about what had happened at the borders and what happened with families and separations and what happened with deportations and all that. So I thought, yeah, I'm going to be right there. And since appointment, I've had to modulate my expectations. And the commission itself is still in the process of formulating its agenda. But what I truly understand is that we can still make a difference. We're going to be submitting rolling recommendations to administration instead of waiting to come up with a big report, saying this is our set of recommendations. And I happen to be one of the co-chairs for the health equity subcommittee, so I feel very comfortable that I know enough to be dangerous, and so I feel very privileged to be appointed, and I really hope that I can extend the influence and get some things done at a national policy level that will eventually affect how things are carried out on the ground by the federal government.
If there is one thing that you would like to see changed regarding healthcare, what would it be?
One thing in that limited expectations.
Yeah. You got to stay positive, you know. No,
Yeah,
really, really, if there's
you
one
know,
thing that you
one thing
really
in the big picture, I
right,
think, really is cover everyone, right? It's
Medicare for
shameful.
all. Medicare
Yeah.
for all. Yeah.
Well, not necessarily Medicare. It doesn't have to be Medicare. It could be. I mean, certainly we've seen different models, whether it's France, England, Canada, Australia, right? It doesn't have to be a Medicare
Yeah,
like,
healthcare for all, you're
yeah,
saying.
healthcare for all. Because it is shameful that here we are, an advanced country with tons of resources, that we lag far, far behind our cohorts in terms of um, our status, healthcare status, and in terms of how much money we spend to get the limited return. Now, in my reduxed version, and it may still be too big of a lift, I would love to see the Medicaid bar lifted. And by this bar, I mean, right now, if you are here legally present, you have to wait 5 years before you can access Medicaid. So, you're working at low wage jobs, you're paying your taxes, but because you're you're here on, a visa, a green card, you can't have Medicaid until you're here 5 years. That doesn't make sense to me. So I'm only limiting it for those who are legally present as something that I hope can happen, because I know how incendiary it is when we talk about covering everyone, regardless of their status in this country, which is a shame, you know.
Well, you aren't leaving yet. You don't leave until what? The end of the year, right?
Yeah, December, end of the
Yeah.
year. Yeah.
Is there anything in particular that you're hoping to accomplish between now and then, uh, there at at ICHS that you hope to get done? Got to
Um,
get done.
well, you talked about COVID a lot. We don't know what that new normal is, right? We know that COVID is not going away anytime soon. So, the big thing that I really want to accomplish in my remaining months here is to stabilize the organization enough. And it's pretty stable right now, but in terms of, systems, in terms of structure, you know, get it solid enough that somebody coming in doesn't have to worry about digging out from under, right? And with that, I acknowledge, like I said, we have vacancies. We need to be able to fill them. We need to be able to train people. We need to figure out how to refresh the people who've been with us the whole time and been loyal members of the team. So there are lots of things we can do aside from infrastructure. We really need to focus on building up our team again. And that
People.
is very important. Yeah.
It's all
Yeah.
about people, isn't it?
Yes. And I really hope that there are those listening to this podcast who will think about ICH and say, yeah, I can work for ICHS. I want to work for ICHS. I want to serve our communities. I think that's very important because that's how community organizations like ours survive and thrive, right?
Right. Yeah.
Community folks have to come.
Well, what's really important is that ICHS is so needed and has done so much and continues to do so much. And that, so I hope those people hear the message and we'll do our best to make sure that we get it out there for you. Okay.
Yeah, and make sure your grandson moves here eventually and works for us.
Okay. I'll keep that in mind.
We'll take them young and
Yeah.
grow
Maybe I,
them.
maybe I can get my daughter and her husband to move up from San Diego. I don't
Oh,
know. There
hey,
we go.
yeah,
Yeah.
yeah,
Hey,
yeah.
Teresita, I just want to say thank you for all that you do. You have been just active in the community. You've worked for mayors and council members. You've been through it all, and yet you've run this organization and done one hell of a job and dealt with COVID and everything else. But thank you for everything that you do, and good luck with the commission and try to enjoy retirement a little bit. Okay.
Well, if you are my model, are you enjoying retirement, Enrique?
I am. I actually
All
am.
right, then I
Yeah.
think I will be able to enjoy retirement.
You know,
Active.
you can still stay busy helping the community, and you just got to find your way, and I know you will. All right.
Yes.
All right. Teresita Batayola, thank you so much.
Thank you so much, Enrique.